have been given a case of 34-year-old woman with swollen right leg. Her only medication is the oral contraceptive pills. Regarding differential diagnosis, make a quick list of possible causes of a given presenting complaint, and ask questions to rule in or rule out the possible differentials, as in this case. Deep vein thrombosis, ruptured Baker cyst, cellulitis, are the top differentials in our list. Here, we are discussing relevant questions to take a brief history, keeping ourselves structured within a given time frame. Now, we ask detailed questions about unilateral swollen and tender calf, using the mnemonics ODPARA. Onset. How did it start? Did it come on suddenly, or gradually? Duration. For how long is it present? Progression. Since the start of symptoms, is it getting better, or worse, or staying the same? Is it the first time, or were there previous episodes? Aggravating factor. Have you noticed? What makes it worse? Is the exertion make it worse? Relieving factor. Have you noticed? What makes it better? Is the rest make the symptoms better? Associated symptoms. Medical conditions, like active cancer or heart failure, prothrombotic states, immobility, for example flight, surgery, especially orthopedic, and stroke. Previous personal or family history of DVT or oral contraceptive use in women. Previous knee trauma or joint problem. Pleuritic chest pain or breathlessness consistent with pulmonary embolism. At this point, we have ruled out possible differentials and reach on a possible diagnosis. To support it, we can perform a quick physical examination and lab investigations. As in this case, examination include confirming the diagnosis of DVT, calf swelling, measured 10 cm below the tibial tuberosity, shows more than 3 cm difference, superficial venous engorgement and pitting edema, examine abdomen and pelvis, thrombophlebitis, local tenderness and erythema, pulmonary embolus, pleural rub and right heart failure, peripheral pulses. Now it's the time to tell the patient about the management part, including investigations and treatment. Regarding investigations, we have options of D-dimer, Doppler compression ultrasound, if D-dimer elevated, thrombophilia screen, if recurrent or positive family history, CT abdomen pelvis, if aged more than 50 years, mammography, in females, PSA, in men. Regarding treatment, we have plan of treatment, anticoagulation, for 3 months if provoked, 6 months if unprovoked, lifelong if recurrent high risk. Compression stockings reduce post-phlebitic syndrome. Meanwhile, address the concerns of the patient. In the end, it's the time to close the case and talk to the examiner.